Hi everyone, Dr. Nemechek here. I want to talk to you about inflammation and heart disease. So in terms of preventing heart attacks, your doctor's always talking about cholesterol, and here's some statins and stuff like that. Well, believe it or not, there's a variety of studies that show us that if you look at the best predictor for preventing your first heart attack, it's not cholesterol, it's inflammation. All right? Cholesterol is not going to do anything until the blood vessels are damaged by inflammation. That's how the process works for you to develop this kind of narrowing arteries that could lead to a heart attack. All right? Now, there's a test that sometimes people do that they should always do if they're doing a cholesterol panel. The doctor should be ordering what's called CRP, a C-Reactive Protein. This is a very sensitive inflammatory test. All right? If somebody's giving you cholesterol drugs and they aren't looking and talking about CRP, they don't understand what's going on. CRP is a measure of inflammation, and the most important kind of predictor is if you're going to have a heart attack or not. All right? Now, when you're looking at your cholesterol profile, there's another test on there that indicates inflammation. It's your triglycerides. Okay? Triglycerides are this big complex kind of molecule, but when you have inflammation, we now know the brain doesn't communicate to the liver correctly, and the liver makes too much of this stuff. So you have a high triglyceride level, inflammation. High CRP level, inflammation. You want to lower inflammation? Okay, if it works, those numbers go down. If they don't go down, you haven't changed inflammation. You have not improved your risk of cardiovascular disease or having a stroke or a heart attack. How do you lower inflammation? The biggest single source of inflammation is coming from your intestinal tract with bacterial overgrowth. All right? Another huge source of inflammation is from the vegetable oils in the food supply or meat that has been fed grains. Basically, it's like soybean oil in your food or the oil in the soybeans we feed the livestock, okay, that you're eating. And olive oil will protect you from that. 2 tablespoons of olive oil a day will protect you from vegetable oils. Sounds strange? The recommendation for daily olive oil was put in the food pyramid in the 1990s. There's a ton of science about it. Unfortunately, no drug company is going to make billions a year selling olive oil, and nobody talks about it. Okay, and then additionally, you want to get some fish oil in you with omega-3s, pretty high dose. Omega-3s are the natural molecules your body uses to turn off inflammation. They're part of the chemical off switch. All right? So balance your gut bacteria. Typically, that's going to involve a antibiotic called rifaximin, or in the U.S. it's called Xifaxan with an X, Xifaxin. A lot of patients have to get the generic rifaximin from a Canadian mail-order pharmacy because it's just too expensive here. You can use a prebiotic fiber like inulin. We sell it. We have Nemechek Blue. Might help some. I strongly discourage the use of probiotics because they can just as easily make inflammation worse as make it better. Okay? And the probiotics are all very different. The bacteria are very different, so you can't just take anything and slop it all down. So if you've got a family history of heart disease or you just want to stay healthy, if your CRP is up, if your triglycerides are up, when I mean triglycerides are up, they're above 150, okay? And you got to focus on inflammation. All right, that's all for today. Everybody have a great one. Bye.